Okay.
Good.
I'm Dr. Philip Shallow. I'm an upper cervical doctor. People ask me if the work I do can help with hot flashes. Well, sometimes it does. About 50% of the time, women with hot flashes, we correct the misalignment up here, and then the hot flashes improve either immediately or over a gradual period of time. Let me show you why that is. Here's a model of the head. Right about here is the area of the brain, just in front of the brain stem, that controls all the hormone balance. Now, why is that important? Because the atlas is just under it. The atlas is the first bone in the neck, and if it's out of position, it squeezes the nerves, it squeezes the blood supply coming up into the head. You see this little red thing? This is the vertebral artery. It comes up into the head. If the atlas is out of position, it's going to squeeze that too, and it's going to slow down the blood supply up into the head. That's not good. That means your brain isn't working. Got it? And so when we correct this misalignment, all of a sudden now we get good signals coming up into the head, good signals coming out of the head, blood flow in and out, everything happens normally. And what that means is now that the brain can control the hormone balance, then things can normalize and hot flashes can disappear. In the cases where it doesn't, there are other issues. It's been bad for a long time and it needs to be approached from different angles. So yes, upper cervical care can help people with hot flashes.